Hello. Welcome to my channel. My channel is called GGNP Health Information. I have over 20 years of experience in the nursing profession and also as a nurse practitioner working in the hospital and also in the clinic. And so this program is dedicated to bringing you information about at this time that I have is the potential profession or potential job or career in the healthcare sector. And that is specifically talking about uh, associate degree programs that can give anyone a good job, flexible hours, and also helping people that dedicate someone who is compassionate in helping people that by doing associate degree in many fields are available in the health profession. It could be outpatient or inpatient or as a consultant. Now today my topic is called a radiation therapist. You can see it at the bottom that is scrolling. What type of job is it? Where do they work, and more. So, radiation therapist, as it's exactly stated, that it is a skill for anyone who completed an associate degree in the radiation therapy education, and that they work in the healthcare sector, including in clinics, hospitals, a research facility which provide care for cancer patient, and also as a consultant. And they can work in a manufacturers that manufacturer that makes the radiation machine, and also they can work as a salesperson with the people who engineer the machine. And so there is a few options once you graduate from radiation therapy education, where to work. According to the U.S. Labor Bureau, that the job is expected to increase by 6% in the next 10 years. So once you graduate with this education, with this program, the chances of being hired right away is high, basically. So radiation therapist, as it sound, is that it's an associate degree prepared program. And what they do is basically they run the machine, the radiation machine. It could be for pediatric, like for little kids or adults. That once somebody is diagnosed with any kind of cancer, then the oncologist will order radiation for that particular cancer. So the radiation therapist basically manage that machine to deliver the radiation to the tumor. It could be liver cancer, breast cancer, lung cancer, stomach cancer. So the radiation is ordered by the oncologist, and the radiation therapist actually deliver that radiation. So this is different than radiology technician or a sonographer, MRI, EKG, EEG. Those are different. This is actually, they actually treat that cancer person, and to at the direction of an oncologist, a physician, and that they treat a, a tumor either to shrink it or to cure it. So that's what their job is. So that means that they have to know how to operate a machine, also about patient care, because a cancer patient, it can be emotional. There's a lot of it needs a lot of support, explanation, how the machine works or where the tumor is at. That's the education that the person will carry out, and then explain to the patient that what they're doing, and also protecting themselves and the patient from unnecessary radiation to the rest of the body and themselves. So it's a focused, very uh, important job, and the safety in mind, of course. So it and also where they work is, like I said, in a clinic, a standalone clinic run by a physician, oncologist team, or in a hospital that is a department of oncology, and also like a teaching hospital that does research and also has medical student that future doctors that where they teach them, and then there is an oncology department there, then they provide that. So uh, radiation therapists can also work in that environment. Like I said, consultant and salesperson also is a possibility of a job. And so radiation therapists operate the machine, as I say, uh, and deliver the radiation that was ordered by a physician to that particular tumor to shrink it or to cure it. So who do they work with? They work with oncology nurse, physician, of course, oncology physician, medical physicist, because they have to have this, we have also, they have the medical dosimetrist. Medical dosimetrists are the people who educated, they have a bachelor degree in science and physics and in biology, and they actually tailored the radiation to a particular size of tumors. Then directed by oncologist physician, of course. So really, you are specialized in specialized in delivering the radiation. So basically, it's different than a radiology technician or sonographer. It's like, for example, that a nurse will have an order from a doctor to give in vaccination. So the vaccination is given in the deltoid muscle. So the nurse has to know how to mark that body part where the injection should go. So that is the, so she doesn't inject that intramuscular vaccination. Doesn't She doesn't give it to the at the wrong side, like a nerve or other spot. So the radiation therapist is just like that. So they have to learn how to operate that machine and how to precisely deliver that radiation to that particular cancer. So that's their job. So it is, like I said, associate degree prepared. And what needs for anybody to be a radiation therapist is that they have to be compassionate, and a good communicator, and a caring person, and also they have to be a detail oriented person to succeed uh, in this profession. So it is good for high school students who are not, they haven't decided what to study after high school, and also for people who graduated, especially immigrant with engineering, biology, physiology, or any kind of profession, but they cannot that they can't find a job, they are just looking, or maybe because of family, they just they're not satisfied, or they want to work part-time but they can't because of the type of the job. But healthcare always had a part-time job that they can accommodate you. So people who have a background in science, and for some reason they can't find a job, and there's some issues, they're not satisfied in their profession, they can try this. It's a 2 years program. So explore this. Definitely, it's something. It's as a choice, an option in the healthcare sector, because healthcare sector always is a strong job market. It has a strong job market that once you graduate, you're not going to be having hard time finding a job. So those are the things. The next program by GGNP Health Information, it will be what's the requirement for a radiation therapist? What kind of education do you have to complete, especially after the generals, like college algebra, intermediate, English composition, fundamental speech, introduction to psychology, of course, anatomy and physiology. What else is there? So that we're going to talk next. That and also the prospect of a job in the next 10 years. What is it? look like, and also the salary. The median salary from state to state, from region to region might be different, but what is the average salary for radiation therapist? Thank you. My name is Gannett, the GGNP Health Information, providing you information about associate degree prepared health job or career in the health sector. Thank you for tuning in. If you like it, give me a like and thumbs up and subscribe. Thank you. Have a good day.